We've been told that Medicaid is this safety net, but due to recent news, I did some digging into my own state, Utah. And I looked back 2 years so that we could pull data, and I found out so Utah spent $5.3 billion on Medicaid. And I found 622 million alone went to what are called waiver programs. So today what I'm going to show you is the price list of what the state has agreed to pay for certain services. And unfortunately, they don't even publish what they actually pay. They just publish these broad totals, but we can see what they're willing to pay per service. And it's quite shocking. So this is the legal loophole of how you could commit fraud legally. And what I mean by that is, just like we've heard of bananas being sold for $100 in military budgets that are just these black boxes, essentially the state is way overpaying for services. So the way this works, it's a fee for service model. So the state has a list of services and then they pay different vendors a fee for that service. So that's not a secret, but the math is quite shocking. So here's the price sheet. Look at, for example, code T1016, case management. In Utah, they're paying $25.39 every 15 minutes. So it's $101.56 per hour. All right, compare that to code S5125, attendant care. That's the person actually helping a senior or a person bathe or eat. And the state's only paying that person $7.50 per 15 minutes, or $30 an hour. So for administrative case management, whatever that means, $101 an hour. The person actually providing care is making $30 an hour. So think about that. The system values managing care at 3 times the rate of actually providing care per hour. I know these case managers, they are not making $101.56 an hour. Now, is this fraud? No, the states agree to pay this, but here's the problem. These case managers work for an agency. That agency is collecting $101 per hour, and they're paying the case manager maybe 15 to 30 bucks an hour. So where does the 70 or 80 bucks an hour go? We actually don't know because those are private companies, so they're not going to publish that. And on top of that, we don't even know what the state paid in total to case management fees. That's just one line item on here out of that $622 million that out of that 5.3 billion. So it's pretty well buried, and they've billed it as claims. So Utah has a transparent.gov site. When I looked up some case management agencies, all of them said zero. However, we know that they're not getting paid zero because they're billing it through claims and care. And that makes the goal for these agencies that get a state contract volume. So they will load up a single case manager with 40, 60, 80, 100 clients and make sure that that one case manager can generate $15,000 to $20,000 in revenue every month for the private agency while making 15 to 30 bucks an hour. It's a pretty good margin. So here's the flowchart. The state pays the case management or the assisted living. This goes deep. Hypothetically, let's say that same agency also has an ownership interest in a home health company and an assisted living. Now they have become the gatekeepers, and the clients have become the cash cows. They're getting paid 101 hours. They get paid $101 an hour to decide basically where to allocate the rest of the 622 million. They can refer the client to their own facility and collect another $79 to $132 a day in residential fees. If those agencies also use preferred realtors to help people sell their homes and get on Medicaid in the first place, oftentimes I bet those realtors are related to legislators or the agency owners themselves, and this has become a closed loop of dollars that appears to be just a budget on the general report, but we have no idea where this money is actually being spent. I tried to look up these private companies and see what they actually made. You know what I found on transparent.gov? Nothing. These case managers on paper make $0 in state fees because they bill them as claims and not as contracts. so they don't show up on any of the transparency websites. I had to submit a GRAMA request, and I still haven't heard back yet to figure out what these agencies are getting paid. So hopefully I'll have an update soon to see how much of the $5.3 billion went to administrative fees, how much of those $622 million that went for specific waiver programs went to these specific waiver fees. But in essence, that $622 million was spread over about 7,000 people is all. So if my math is right, for these 7,000 people that are the highest needs on these waivers, the state spent $88,857.14, roughly $90,000 per person. And most of that went to administrative fees, as we've already seen, which the state values at least 3 times the rate of actually providing the care. Meaning there, if not fraud, is a ton of waste in this system. Honestly, I would be in favor of just having the state give these people $90,000 a year to improve their life instead of pay an agency and a manager and a case manager and then finally pay $7 an hour to the person actually providing care. And overall in this video, we've only talked about the waiver programs, which is about 12% of the total budget. Of the $5.3 billion, the largest majority of that is going to managed care models, which are their own black box, as well as a whole host of other things. And I think the worst part about this whole thing is, given the amount of fraud and waste that is likely in the system, due to recent policy changes, the Big Beautiful Bill, up to just 200,000 people in Utah alone are at risk of losing their Medicaid benefits entirely. On top of that, there's already stricter requirements for people to qualify, a ton of paperwork for them to renew. And it seems to me like most of the funding that we're getting anyways is just wasted in seeing if you do or don't qualify and paying administrators and paying case managers. I'm going to be doing a lot more in-depth videos on different sections of Medicaid in Utah and some other states. So stay tuned for more, and please like and share this. It helps the channel grow.